everyone has mental health. It's very much like physical health. So we want to be physically well. We want to be physically well, doing all the things that help us stay healthy and fit physically. And similarly, mental health is equally, in my opinion, possibly even more important. If we're not mentally healthy, then it has an effect, all sorts of effect, even on our bodies. As human beings, we all have emotions. Emotions, feelings, it's okay. When any emotion, such as feeling depressed or feeling low is okay. If you've had some sort of trauma, some bereavement, a loss of some sort, you've lost your job, you're feeling low, that's okay. If this continues and it's going on for weeks and even months, then there's a problem. If that low mood and feeling depressed and sad is carrying on for a very long time, then that's when you need to seek some help. So any emotion, if it's excessive, then it's a problem. Anger is good. We all have anger. It's an emotion. It's a good emotion to have. If it's excessive, now every minute of the day you're feeling angry and you're being abusive, or you're reacting to your anger and being unkind, then it's a problem. And all of these could lead to some kind of mental issues, an illness, possibly something else that needs to be investigated. You need to go and seek some help.
Okay, so we all exist on a kind of spectrum in that we all have stresses through our lives, and we can have difficult circumstances that can befall us. As a result, everybody reacts emotionally to things that happen in their lives. Sometimes that's kind of differences that can be fairly common. So we'll all have times when we feel a bit low in mood. We'll have times when we feel a bit kind of elated and over the moon and overjoyed at things that happened. And so there's a very broad spectrum of emotions that we can have that react to things. Sometimes when there's been some major things happen in our lives, there's been some major stresses and strains, then the reactions can be quite significant. And they can be significant in a way that really impairs our life. So we end up finding it difficult to go to work, or finding it difficult to go to school, get involved in education, meet with our family, celebrate functions. We find that we're disengaging from the world in a way that's very different to how we used to be. That's the kind of time when mental health professionals get involved and people start talking about mental health problems and how they can help. So it's in that sort of latter category, when it's really impacting on your life, that people often come for help. It can be very common. Large percentage of the public, something like 1 in 4, will have a mental health difficulty, and so they will end up needing help. And it's very important for all of our communities to be aware that that help is there, and if they need it, they should approach the right people. And at the very least, at the very minimum that people can do is start to talk to others about how they're feeling, because often it builds up. So it's really about being able to share your emotions more, keeping less inside. Of course, some things we keep inside, but not keeping too much inside. So the very first and least thing you can do is start to share with others around you, family, friends.
In terms of mental illnesses, there's various mental illnesses. Not all of it is accessible. It's not everyone has it. Some of the common ones that we see in more familiar with, that people are familiar with, like depression, anxiety, phobias, eating disorder, you've got substance abuse. All of these things can lead into different areas of mental difficulties. It'll be more of a thing of exploration. You need to go and explain your symptoms, what you're feeling, how you're experiencing life at the moment, and maybe your doctor could help you and with the treatment. Not necessarily going to the doctor just to get some medical treatment, but sometimes to get some advice on what to do, because it's not always necessary that you need medical treatment. It could be that you're feeling depressed and it's a low patch in your life, and that's normal. All lives go through ups and downs, and we all experience it times when we're feeling quite depressed and low, and it's justified. Other times, if it seems like it's excessive, it's going on for a very long time and you can't get yourself out of it, you're having sleep disturbances, you're not feeling like going out with friends or talking to people, and you want to isolate yourself, there's a whole collection of symptoms that then give that diagnosis. That's a different area. Even when these things have become a bit of a problem for you, that's when you need to start thinking about how do you get help. Maybe you've tried on your own to encourage how to change your sleeping times, etc., and it hasn't worked, so you might need to go and seek some help. And that's the key point, that whatever you're experiencing, if it's going on for too long, it's excessive, it's not justified, that you've been feeling this way for months now and you want to get out of it, you seek some help. And for these common disorders, anxiety, depression or phobias, like I said, it doesn't necessarily mean that you're helpless and you can't get any help and no one can help you. Actually, there's a lot of treatment out there that could help. Of course, you've got your GP as a first point of call who can advise you on what to do and whether you need medical treatment. But most of the time they can refer you on to other people like therapists, psychologists. Sometimes you need specialist help and you might need to go and see a psychiatrist. Again, that's it's not unusual, but you need to go to the specialist, the people that could help you with this collection of symptoms. And that's what it is, it's a collection of symptoms. And it's different for everyone. Not everyone's going to have the same symptoms. People might have a few of one and not the other, but it's okay. That's for the professional to decide, and they'll do the correct assessments and come to that conclusion. For the individual, it's to get the help.
Mental illness is seen as something that should be avoided.
We don't want to be associated or known to have it. As a culture, that is quite shunned. It's a shunned view that we have. We don't encourage that people talk about it or associate with it, mainly because mental illness is seen as something that should be avoided. It's something, if someone is mentally unwell or mentally ill, then they might be aggressive or they might be dangerous in some shape or form. So it's something that people avoid talking about. So if a family was to have an individual that has a mental disorder, which is viewed very negatively, there's stigma associated with having a mental disorder. So then others around them would avoid them. There's difficulties in marriage, there's difficulty in proposals, there's lots of breakdowns that happen when there's a mental disorder in the family. It's mainly because there's no openness to discuss, there's no openness to learn and find out how we treat these things.
If we just think about the language itself, there isn't really a good Bengali term for mental health problems or mental illness or any of these things. Even in English, mental illness is considered to be sometimes a bit more pejorative language, not necessarily respectful language, but at least there's a kind of term for that kind of thing. In Bengali, I'm not aware that there is a term, other than almost abusive terms to describe people who are suffering mental health problems. So there is a bit of a stigma around it, that's for sure. And because of that, I think that people are very reticent to come forward to seek help. Also, there's concern about the community and what other people might think, which is related to the stigma. And if you're seen to be going somewhere for help for this, it can lead you to feel like you need to hide it and to keep it quiet if it's you or another family member.
Family members, friends, community, this is a taboo subject, that you have a mental illness, you are not allowed to talk. You will see a lot of young people, some of the young people will have anorexia, eating disorder, bulimia. Parents and family members will hide it because they're fearful of other people knowing it. They may have problem getting jobs, they may have problem getting married. Other people will talk bad about it behind them. That is the fear stops people seeking for help.
From my experience working as an imam in the community, in the masjid, there are many people who come from our community talking about their problems in life, stress in life, depression, and they will normally attribute this to jinn possession and black magic. And I'll give you some examples that some experience that, like some say that they have marital problems, the child is not behaving correctly, sometimes an outburst of anger, being physically. So all of these are symptoms, and they will attribute these to black magic and jinn possession. However, in the masjid, and we have also Ruqya Center, imams and Rakis, the Ruqya practitioners, they help into diagnose if it's really a jinn possession or black magic. So whilst working with them, with their clients, they will normally see that, majority of the case is not jinn possession related or black magic related. So they will normally refer them to as a psychological issue, and therefore they will refer them to the GP services and psychological services out there.
GP is at the first point of contact. More than 90% patients with mental health problems first come to their GPs, and only about 10% gets referred to the specialist. So sometimes some people have a feeling that GPs don't listen, GPs don't do much about it, and GPs only give medications. But it may not be the truth, the whole truth, because what GPs do, they listen to you. So even if GPs are not specialists sometimes, they are still able to signpost you. So you come to your GP, you tell the GP your problem, GP does the risk assessment. So assess that if it is an immediate risk, so you need to go to the hospital today, or it can wait and can be referred to the hospital. We may signpost a patient or treat a patient. Treating not necessarily always giving medications. Treating could be referring to psychologist. Treating could be referring to even a walking group. So I have patients who find hard to walk alone. So because to try to improve that person's mental health, I have given the details and telephone numbers of walking groups in Tower Hamlets. Sometimes people have, tea group, like a group of people with mild dementia have Friday morning, they may meet in East London Mosque. So they have a group. And as a patient, you may not be aware of all these resources, which as a professional, I am aware.
As a psychologist, what we're studying is people's behaviours and their thoughts and feelings. So in terms of behaviours, we all have behaviours. We're all doing this certain things. It's how we're speaking, how we're carrying ourselves, what we're thinking. All of these things are behaviours. And sometimes it's possible, to not know. Nobody knows what they're doing, like what behaviour they're doing all the time and why they're doing it. So actually coming to a psychologist, they can help you to look at this in a very simple way, break it down for you. And what they'll do is help you with certain understanding of your own behaviour. So a person may be feeling down at the moment, and because they're feeling down, they don't really feel like doing anything, going out with their friends, etc. And this information can be something novel. They don't understand it, why they're doing this, why they're behaving in a certain way, or why they're thinking in such a negative way. And these things, this is what a psychologist does. They break it down and explain it to you and what's happening, and then how you can help yourself to get out of it with the help of the psychologist.
Essentially, my job tends to be to work with a team of people and together the most important thing that we can do with people is really listen and try and help them create a bit of an understanding of what's happened to them rather than necessarily impose a judgment on them. And then, if necessary, when things are more severe, we might get involved directly to do some specific things. So there might be certain kinds of specialised therapies that we might engage in with them, that we might get people to engage in with them, or there might be some medications that they might need in severe circumstances. And there's a variety of those that you might use. In my view, it's always important not just to have medication, but to have other things with that, so that they're not only dependent on the medication, but the medication is an example of a specialised thing that they might need to help them. So the idea is that if people come to me, they usually come to me because they are suffering, and usually people around them are suffering too. So it's usually being able to help the whole group together, but it's also very important that where there's more severe distress, to help them with that, and in the most severe circumstances, then bringing them into hospital and organising for them to come out of their own environment can be useful. But most of the time, the vast majority of the time, it doesn't involve hospitalisation. It'll involve one of these other things that we're able to give them. But most importantly, underneath all of that, is really listening and helping them understand what got them here in the first place.
Couple of years ago, 2006, I became really unwell, and I was taken into A&E, and later on I was diagnosed with schizophrenia. From that time on, my whole life changed completely. I was left in trauma, I was left in sadness. I wasn't really disappointed with myself or anything, but I just didn't have the answer to my illness. I didn't know what caused it and how I could, get myself better again. But things became really very confusing because there was no answers for myself. I didn't have the inner peace in my heart because mental health illness was something that wasn't in the family, and not many people in my family knew what it was. And obviously, first time in my life, I was seeing a lot of doctors. A lot of people from around the community came to see me. I was bedbound for some time as well, and things were really hard for me. My day-to-day task became really hard. I was about to go to university where I couldn't make it, so I had to just stay at home. For about 8 years of my life, I was just at home doing nothing and just suffering in silence because I didn't have my own words to say to anyone, because it was just my family speaking on behalf of me to psychiatrists and clinicians. So things were really difficult. Slowly, things became a bit better and things were in control. Like I managed to go to a lot of places, sort of like religious activities, meeting imams and finding out what could be the cause to my illness from an Islamic perspective. And there were simple tasks that were given to me, like to read Quran and to pray my salah on time. And there was other things like breathing exercises, meditating, going to green spaces, relaxing myself. One of the reasons why I became unwell was because I had a negative thought in my head, and this negative thought led me to worrying over it, and through this worry I went through a phase of depression, and that's how it triggered everything. So now what's happening is things are looking positive for me because I am on my journey of recovery. Things are getting better for me. So in my recovery, when I was unwell, there's a lot of support which I got from my community, friends as well as family. I mean, my mum and dad were there always for me, visiting me. When I was in hospital, I had relapses 5 times, and they were like in the hospital every single day with whatever I needed. One of my uncle, he lives quite far away from me. I was in touch with him all the time, and he used to give me certain advices all the time. Whenever I would have a little breakdown, I'd call him immediately just to see if there's any help available from his side. So he would tell me, comfort me, and also tell me don't worry, things will be okay, from an Islamic perspective as well as from a normal Western perspective as well. Also, I had friends. My friends were so close with me. They would come and see me on a daily basis when I was at home and in hospital. And one of my friend, he still stays with me all the time. He's like, he went through the same phase as me as well. So we both understand one another. Even now, until now, there's a lot of stigma around mental health. But I think mental health is something that shouldn't be, deemed low, because anyone could get sort of mental health anytime, and it's just a normal illness like any other illness. From my experience, what has helped me in my recovery are firstly my friends and family. They were there at the most hardest times of my life. Secondly, I found spirituality really important for me because I'm a practicing Muslim and I practice my faith very strongly. So reading, reciting, doing different actions has helped me a lot. Also going to colleges where I studied about my illness has helped me a lot. And things like, staying active, doing regular exercise, as well as, going to different places just to relax myself. I've noticed that a person when he or she is going through this phase, the mind is not relaxed. The mind is always occupied with something like voices or negative thoughts. So relaxation was very important for me. Recovery is a journey. Sometimes you'll experience happiness, sometimes you'll experience sadness. Recovery doesn't mean that always you will recover. It sometimes may mean you might not recover, but it's a journey of trying to get better. Yeah. In this journey, you need to know yourself, you need to love yourself, and you need to accept your illness. The moment you accept your illness, you feel better. Because if you don't accept yourself, accept your illness, then you'll become sad inside. Like myself, I was really sad. So remember, things will take time. Things don't happen overnight. Gradually, slowly, take your medication, do some exercise, go to green spaces, read books, do something creative, art groups. Whatever you do, do it so that you become busy with that, and then these things will help you in your journey. Relaxation, the psychotherapy service, cognitive behavior therapies, these are all there to make you better. So whatever services you have in your community, take full advantage of them, because these are there for you to get better.
If you feel that you are healthy, you need to continue being healthy. How can you do that? You can keep yourself busy, doing some regular physical activity. If you have a problem, find a person, not many even, find a person to talk to express your concerns and get some support, because families and friends are there to support you. You should know that, not hiding problem. But obviously, you don't want to talk to everybody about your every problem, but trying to identify people who you can disclose your problem to. Plus, physical activity is very important. That not only keeps your mental health well, it keeps your physical health well as well. Plus, seeking for help. There are lots of organizations, voluntary and third sector organizations out there, and GP is a professional, and nurses and other health professionals which you may not be aware of.
The most important thing is to talk to people around you, so don't suffer in silence in yourself. I think the one thing that can make things worse and most severe, and ultimately lead you to have a more intensive intervention, getting into hospital and things like that, the one thing that's more likely to do that if you keep things to yourself. So try and share it with people close to you. Could be your mum, could be your partner, could be your siblings, your family, friends. So it's important to start sharing things with people. And if between you start feeling that there's more than you can handle yourselves, and that actually the distress you're experiencing is too high, then I would start to mention it to your GP and get their thoughts on it. Now, the GP can do a number of things. Medication is one thing they sometimes consider, although that's less encouraged these days. The alternative is they have a significant option of counselling, which they do have counselling services that GPs are linked with and are able to access more than anybody else. So that's the next thing they could do, is try and get you some counselling, some professional help. And if it's more severe than that, and you're really very distressed, and say you may not be sleeping for long periods of time, it's really affecting your life, then they might start engaging mental health services.
Islam encourages us to seek treatment. When we are not feeling well, we have to seek treatment. seek treatment from the people out there who wants to help us. And we shouldn't be ashamed of what we have. We shouldn't be hiding ourselves, but we should come out and get help.